Pine Tree Society's case management serves children 0 to 20 years old, 0 through 20 years old, serving kids with developmental disabilities or chronic medical conditions. For eligibility, we require Maine Care Services or Katie Beckett and need to be within 1 hour of our offices. We currently have offices in Scarborough, Auburn, Bath, and soon to be the Central Maine area in this fall. Our staff are quite diverse. We have staff who have special education backgrounds, social work, have been in the caregiver field, and in my opinion, some of the most valuable has been parents of kids with special needs. We can do a variety of things depending on the age and need of your child and what your needs are for a family. Some of the younger kids, it's connecting to resources for home and community supports. It could be supporting transition planning into adulthood if they're older, adolescents. Being that added person at an IEP meeting or other meeting just to listen. And one of the most common pieces is, we are that person who listens when things get tough. Distance learning and homeschooling, we do have experience working with kids who have been in those scenarios before. So we're familiar with how to access school programs, how to follow through with IEPs or 504 plans. And a lot of pieces that we would do is make sure you have access to community opportunities, connect with homeschool associations, and coordinate and support those providers as well so that you have successful programming. We can help support online therapies and access to those therapies by coordinating with either the school or outside providers. We've done this throughout the COVID piece as well as prior, given special needs of specific kids. Some challenges have been access to technology to be able to do that. That's something our case managers can help with as far as getting access either through the school or through technology elsewhere. A big part of what we do also is connecting kids and their families to the larger community, and making friends is often one of those things that is a priority goal for families for their child. We can do that through connecting to services, helping refer, managing those services, monitoring them for success, as well as providing opportunities that are in the community already, so resources about those, and then connecting with them as well that may have specific interests around cooking or athletics or otherwise, and we can look for those resources and connect them to a peer group that might be helpful. Connecting to services when you are homeschooling or doing distance learning can be done in a couple of ways, and we can support with that through either coordinating directly and collaborating with the school to make sure those services get accessed either online and are successful with supports as needed. Oftentimes there's also outpatient therapies, speech, OT, physical therapy that we can make referrals for and again monitor and set up for you as a family. During the COVID pandemic, anxiety has gone up for most people, and kids are not an exception to that. Oftentimes they've come in with anxiety disorders, and some have seen regression as a result. We can help do that through, again, accessing services that can directly address anxiety as a symptom. We can work on coping skills. We can work on exploring med management options if that's appropriate, and whatever may work best for your child. There's a number of therapies that could also be accessed as well as counseling.